Welcome to Introspection, the podcast about moving from grief to growth. I'm Amy Lindner Lesser, your host. Introspection started out as a podcast about hospitality, innkeeping, and innkeepers. After about a year, I realized that my life and interests have morphed from hospitality to helping others navigate from grief and loss to growth and living. In this new version of Introspection, I will be talking about my personal experiences with loss, and there are quite a few, what I've learned along the way through my professional training, as well as from my coaching experiences. I'll also be bringing in guests to share interesting ideas. So grab a beverage, find a comfy place, take a deep breath, and listen in. Hi, everyone. I'm Amy Lindner Lesser, your host for Introspection, Grief to Growth. And today I have two guests, and we're going to be talking about something that is near and dear to my heart, and that's about infertility. This month happens to be National Infertility Month, and some of you know and some of you don't know that that's something that I went through also. So I'm really excited because both of my guests were co-authors of the Grief Experience book that I was in. We each wrote a chapter, and infertility is something that you hear many people, especially women, talking about, but don't hear many men talking about infertility. So I'm really excited to welcome my first guest, Dr. George Garcia, to tell us his side, his story of infertility. And then we'll be joined later by Elena Bullock. Dr. George Garcia is a licensed marriage and family therapist in the states of California and Ohio. Welcome, George, to Introspection. As I mentioned, infertility is not something that is foreign to me. About 42 years ago
Okay.
is when I was dealing with it. So tell me about your journey.
Well, there's kind of different pieces to this story for me. When I was 18, I was getting ready for college. Really excited about that phase of my life coming up. And part of the process included getting a kind of a routine physical, or what was supposed to be a routine physical, blood work, all that stuff done, and submitting that to the university. So I go in, thinking no big deal. I'm pretty healthy. And the doctor, I remember, at the end of it says something's not right. And first time I've ever heard the doctor say that. So I'm like, now I'm anxious. What's going on? What does that mean? And so it was probably about a year worth of testing to figure out what was happening. And I did, tons of blood work. I had an MRI of my brain. I did a chromosome analysis, all these different things to try to figure out what was happening and why it was happening. And ultimately, it concluded that they still weren't sure why it happened to me. But they diagnosed me with something called hypogonadotropic hypogonadism. Very long technical term, very hard to spell. But basically, what that meant was my pituitary gland wasn't producing the chemicals that it was supposed to. So specifically FSH and LH. That resulted in very low testosterone, and at the time, almost non-existent or very low sperm count. Obviously, it was really impactful at that time. It was a really tough pill to swallow, a gut punch almost. But at that time, the weight of what could come didn't really set in for me because I was about to be a freshman in college and I wanted to get married and wanted to have kids, but there was no girl in the picture for me at the time. And so it was like, that's something off in the future. And historically, the other parts of my story that I think are closely related to infertility, but different, had always served me and worked in this narrative that I could overcome adversity. And so there was a part of me that felt like, well, when I get there, when it's real, I'll figure it out because I always have. And infertility was really the first thing that I wasn't able to figure out or that I wasn't able to master no matter what I did. So fast forward a few years, I met someone who is now my wife in college, and we start dating, and we're moving closer to wanting to get married. And I knew I had to have that conversation with her, just knowing that she had wanted children at some point, and not really knowing how that was going to end, how she was going to take it. So I actually had a conversation with her and her parents about the diagnosis.
Wow.
So they had full clarity before they say yes. You know, we're supporting you in this in pursuing marriage. They all stuck with me through that. They supported me as I was getting individual treatment. Fast forward a few years later, really in the height of COVID, my wife and I went through the year that they require to diagnose you with infertility, and had no success. Got into a clinic. We did 3 rounds of IVF. First two were unsuccessful. The second one was actually a miscarriage. And then the last round, literally on our last embryos, I'm thinking if it doesn't work, we're done doing this. And we were just blessed with our daughter, who's now 3. A couple years later, fast forward again, we're gearing up emotionally, mentally, physically, financially for another round of IVF. And we were actually surprised with the pregnancy of our son, who is now 1.5. So it's been a very interesting experience, even being on this side with 2 biological kids, one of which was conceived naturally, and still dealing with the infertility. So in kind of a little bigger of a nutshell, that's my journey of infertility and going through all of that process.
I remember hearing from the endocrinologist who we were seeing for fertility saying to us that I think it was 90% of all couples
Mhm.
who have a diagnosis of infertility, it's each of them having something that's not quite right physically
Yeah.
causing that. Were there issues on your wife's side too, or did they just throw this at you?
I had probably a total of 8 different endocrinologists, andrologists that I worked with, and there was only one out of the 8 that said, "Hey, let's have your wife get checked and make sure things are good on her end too." So very interesting. And when it was a shock when he asked me that, because I was just always under the impression that it's just me, never even considered anything for my wife. And thankfully, she was completely healthy. Everything was looking good with her. So we kind of narrowed it down to this is just male infertility. And so with my doctors, I was the patient. At the clinic, I wasn't the patient. And even that just created a very interesting dynamic for us.
So I have to ask, what was your reaction and how did it affect how you, as really a young adult, very young adult, take this news?
Yeah, well, when I was 18, it was definitely a gut punch. I was in fairly decent health at the time, I would say. And just it really was an experience of why me, or how could this happen to me? What did I do wrong? Particularly because of my relationship with my parents. So not growing up with my parents, grew up with my grandparents, and I had always made it my mission growing up to be the dad that I always wanted but never had. And the one thing of all the things that I could have had, it was this. That was the biggest repercussion, that I might not be able to have kids. The doctors were always hesitant to say never, but they told me basically don't count on it. And so that was an initial gut punch. Once that kind of settled, and I got onto treatment, it was almost kind of this joyful arrogance, if you will. I really slimmed down. I grew actually about 4 or 5 inches. So really positive physical benefits from the medication. And then again, just with my history of having overcome some adversity in life, kind of thinking, yeah, I'll be able to get over this. Like I'm committed. when the time comes, I'm good to go. When we were going through the IVF process, that was probably the lowest of lows for me. I had never experienced a depression like that before, and even just what it did to us relationally as well was really a challenge. And I say relationally, meaning how it influenced the way that I showed up in the relationship. My wife was amazing and she was supportive all throughout it, always reminding me that she was fully content with just me. But I had so much guilt and shame around what I thought I was doing to her and robbing from her. And so that was a really hard season.
I bet it was really tough. I can relate in that I did a year of shots of
Hmm.
fertility injections, and it was my husband, my late husband, who had to say, "Okay, you ready to be a pincushion now?" And would jab the needle into my butt. It got tough, and
Hmm.
it took lovemaking to a completely different level. It was like, "Yeah, I don't really wanna do this."
Hmm.
It was mechanical.
Hmm.
I was told I had to lay with my legs up in the air for,
Yeah.
I think it was a half hour, and I'm like, "Really?"
Yeah.
And then I would walk around a mall, or at the time, I was working for Planned Parenthood,
Okay.
and I was dealing with tons of very young women
Hmm.
and, and older women too, but young women finding out that they were pregnant and not wanting to be pregnant.
Hmm.
Or walking around a mall and seeing usually younger women, like I would say in their 20s or younger, who would be grabbing a kid who's toddling around and yanking them forward. And I'm like, why? It's just, it's fate. And because of biology, they could have a kid. And here I am for a year of
Hmm.
misery to have a child. It, the unfairness of it was
Yeah.
really debilitating at many times. Well, I didn't have to go through quite the same thing, and I never questioned, which I could see happening, my gender identity. But I think for a guy, there's more in how we perceive our gender and our sexuality. I
Mhm.
remember thinking for years I was worried that I was going to get pregnant. I didn't have to worry about it, not having to have that over my head. There was a lot of sort of cursing God. Why did you do this? I never heard anything out of my husband.
Hmm.
So I don't know when he passed away 26 years ago. So I really don't know.
Yeah, that's so interesting that you mentioned that. Infertility is very interesting in that many times people often go through it alone or feel like it's just them when it's a lot more common than people think. And it's not just the inability to become pregnant, it's the inability to sustain a pregnancy. And
Mhm.
so that opens up the spectrum a whole lot more than what people might initially think. At the time when we were going through our IVF process, I was near the tail end of my doctoral program and I actually wrote my dissertation on male infertility and used the lens of ambiguous loss. And I interviewed a total about 10 to 12 people. And that provided so much comfort. It normalized it for me as I'm interviewing these people just about their experiences. In my mind, I'd often think I have felt that too. And just to know that there were at least 10 to 12 other people out there that have experienced something similar and likely more that they would tell me about really made it feel like I think I'm more connected than it feels.
And that's comforting to know. It really is.
Hmm.
For us, it was on both sides. I knew that that I had fertility issues going in. We didn't know that Steve did too. It was a kick in the pants, but
Yeah.
for me, it was like, okay, it's not just me, that
Hmm.
he
Hmm.
gets to share the frustration and the anger and everything else. This is the first time that I'm saying that publicly,
Hmm.
that I've talked about my own infertility issues, but not couple. So as we were going through it, nobody knew that it was both of us. They all just thought it was me.
Hmm.
And
Hmm.
it was okay. I didn't care. In some ways felt I was shielding him from it.
Yeah, it's a very interesting experience as a male, and to have male infertility diagnosis. There's been so many times where I've picked up medication or treatment for myself, and they always have you talk to a pharmacist, and they'll ask if you have any questions. And by now, I feel like I'm a pro, but every time I've gone to pick it up, they've always used kind of feminine language. So have her do this, or if she has questions, never crossed their mind that it could have been me, or that's why I was picking it up.
Was that regardless of the gender of the pharmacist?
Hmm. Yeah,
Interesting.
yeah,
My father was a pharmacist. I wonder how he would have handled it
yeah. And it was clear that they never read the name on the
on the
medication,
label.
just saw the medication and assumed it was for a female.
Interesting. Yeah. For us, we were very fortunate that my insurance covered us
Okay,
for 12 months because the treatment that I
great.
was on was very expensive. And so we made the decision that we would do it for 12 months.
Okay.
And when they stopped paying, that was it.
Hmm.
And we would figure out an alternative way to become parents. It was important to both of us to be parents, not as important as to how. Whereas I know there were many women that I talked to in the doctor's office who had been going through treatment um, for years.
Hmm.
And so we said 12 months. And on the 11th month, we started to look around for adoption.
Okay.
So, it hasn't worked yet. What are the chances that it's going to work the 12th month? Did you and your wife ever have that discussion? Like, how long would you keep trying? And
Yeah, we definitely did, especially once we saw, the total cost of something like IVF. They ruled out pretty much everything else for us, IUI, and went straight to IVF with ICSI, which was helpful in some aspects to know, let's not use any time or money there.
just for our viewers' information, IVF is in vitro fertilization. Artificial insemination can be by donor or by spouse,
Hmm.
and there are different alphabet soups for those.
Yeah, and the ICSI is very, it has it's a long term a medical term, so I don't even think I could pronounce it. But basically, they're taking the sperm and injecting it directly into the egg to give it the highest probability of developing into an embryo.
They're removing the egg to fertilize it directly, as opposed to doing it through the uterus or the ovaries.
Correct.
Okay.
Yep. And that's typically happens when there's a very low sperm count, and they're anticipating the sperm not making it to the egg. Yeah, that's where we kind of found ourselves. But we had conversations. I think we were willing to do 1 to 2 rounds of IVF. We talked about having donors or having sperm donors and embryo donors. The embryo donors we didn't quite get to in at length in conversation because my wife was deemed healthy, and so we figured let's have at least one of our DNA. Yeah, I don't know if what we would have done if we had gotten to that point, because that was a little harder for me to kind of swallow at the time.
See, and I look at my children and say, "Oh, they're so lucky. They don't have my hair. They're not pale.
Yeah,
They don't have, familiar history of diabetes." So, in some ways, we were very fortunate in every way. I remember saying, "I'm fine with that. They don't need my genes. I don't have
hmm,
great genes. I have, a lot of diseases that are
okay,
in the family, and my husband and both of us wore glasses all the time, and it's like, maybe they'll
yeah.
have better eyes. They both wear glasses." Um, I really do believe that things work out the way they're supposed to.
I remember the night that my wife told me about our son. We didn't know it was a son at the time. Um, we're just going through our day. I actually went, worked all day, came home for dinner, and went to a late night jujitsu class. And she texted me and asked when I was going to be home, which I thought was weird because we have a calendar on the fridge, and I'll write out, where I'm at. And, I started asking her, is everything okay? And she says, yeah, just wondering. I say, okay, that's kind of strange, but she would ask me to come home if she needed me. So I go to the jiu-jitsu, I get home, not even showered, I'm sweating and stuff. And she gives me a little bag. And at the time, I was doing this pea protein cleanse, and I was trying to get her to do it with me. And so in the card, she writes a bunch of stuff, and then at the end says, I will fully support you in this pea protein cleanse, but I won't be joining you after all. And put dot dot dot, and then at the bottom of the bag was a pregnancy test. And I was completely surprised. I'm like, no way, this is like, we were literally told there's no chance. This would be the most foolish bet you could make, to bet on us to have a child naturally. And turns out, it was true. And we had a Doppler as well from our first child, and it was like every day I was wanting her to use it, because I'm like, there can't be a baby in there. This is, I was told this is medically impossible. So I need to hear the heartbeat again. Like, are you sure that's not another sound that I'm hearing? And even questioning being in the doctor's offices of, how does this happen? And ultrasounds, can I see that again? Are you sure that's a baby and not something else? And it was so hard. And I think hard to believe because it was conveyed as impossible, but then also because infertility, I think, also taught me to be protective of myself, not to get my hopes up, which is very interesting. It makes a lot of things hard. So I want to celebrate this, but I need to protect myself. But at the same time, I also want to connect with my wife. I want to connect in this moment. And it just made things like that difficult.
That's a wonderful story. It also shows up how little medicine really gets. They really don't understand. We're not machines.
Hmm.
And so just because you do something 12 times and every single time it's exactly the same
Yeah.
doesn't mean that the 13th time is going to be the same.
Hmm.
Like,
Hmm.
surprise.
Yeah.
And it's also, of course you're protecting yourself. You've had, how many IVFs had you done that failed? So there was every reason to believe that there would be a problem and that it wouldn't work out, which also is not a great thing for the pregnancy and for either of your mental health,
Yeah.
when you're waiting for the other shoe to drop.
It took quite a bit of therapy and open conversations with each other, and being very intentional about being present in the moment. I remember myself having a lot of anxiety of, what if we don't make it? Like, I didn't want to tell anybody that we were pregnant until I had a baby to show them. And I remember my wife constantly telling me, we're pregnant right now. We might not be tomorrow, but right now we are. So let's enjoy this moment together. We can share the news with people today. Tomorrow we'll see when we get there. And it
What a
was,
wonderful attitude.
yeah,
I think it's a great lesson for everyone, whether they're going through an infertility phase in their life or whether they're just living life from day to day. All we have is today. And
yeah,
we're so concerned about what the future is going to bring. We're not living the present, we're
right.
wasting it.
Yeah. Infertility is one of those things that makes you sad about the past, but yet anxious about the future.
Mhm.
And it pulls you out of the present moment, where you can and get to celebrate things like a surprise pregnancy, or an announcement that looks a little different than maybe what we originally envisioned, but nonetheless an announcement, right? Or something like that.
It may sound weird, but even to celebrate morning sickness,
Uh huh.
like, it
Yeah.
means that there's a pregnancy.
Oh my gosh.
No matter how miserable she
Yeah.
feels,
Yeah.
it's proof. It's proof that
Yeah.
hormones are wacky.
I told my wife often, I love the fact that you're sick. I love hearing you throw up because it just reminds me that the baby's in there.
Well, I appreciate you sharing so openly what your journey has been. Is there anything that I have not asked you that you would like to share to help our viewers?
I'll throw this out. The one thing that I've come to realize at this point, and I mentioned earlier, I have a three-year old, almost four in a few months, who was an IVF baby, and then we have our 1.5 son who was conceived naturally, total surprise, and I love them both so much. They're literally my heartbeat, right? And every moment is not enough. Like I count down the time to get back home to be with them. Something that we never thought was going to be possible. Being on this side with those two kids, though, I've realized that there is really no finish line with infertility. A baby, or in this case, my two kids, who I love more than anything in this world, don't and can't fix the trauma from infertility. It doesn't matter how fast you get to the finish line, right? If that first round of IVF worked, or how many times we reach that ideal outcome, right? Having two, three, four, or five kids. Infertility really is an ongoing process of healing and grieving, whether you have a kid or not. And I think that's been the biggest thing that I've learned and am experiencing and walking through in this stage of my life after having all the experiences of infertility treatments and then coming out with two children.
It's very true. It's like every other disease.
Hmm.
It, it's there that even if you're cured,
Yeah.
and that doesn't usually happen with
Yeah.
infertility, although it could. If it's an issue that can be corrected and fixed with surgery,
Hmm.
then it doesn't exist anymore, but it did exist.
Right.
And so there's still that history and that cell memory
Hmm.
of
Hmm.
that. Therapy, counseling, even coaching can help.
Hmm.
And
Yeah.
so I'll put a plug in that if you or somebody you know is going through infertility, there's still life, and getting help, talking about it with other people who are professionally trained will help so that it doesn't consume your life.
Absolutely.
Well, George, thank you so much. I really appreciate this. And we'll be back in a few minutes with Elena.
Life quakes or life transitions and the aftershocks that follow are something we all experience. A life quake can stem from the heartbreaking grief that arises from the loss of a loved one or the disorientation felt when life suddenly shifts due to the loss of a job, relationship, identity, or health challenge. Learning to navigate these transitions with mindfulness, grace, and self-compassion is the key to finding your way back to joy, happiness, and inner peace. Advanced Grief Recovery Method Specialist and Certified Life Transition Coach Amy Lindner Lesser, MSW, expertly supports clients to navigate their life quakes and transitions with warmth, kindness, and grace. Learning to accept support as you navigate your way through the aftershocks is one of the most powerful gifts you can give yourself. Learn more at introspection.com. That's introspection.com.
My second guest today is Elena Bullock, who is a licensed mental health therapist and owner of Bullock Mental Health Counseling. Elena graduated from Sage Graduate School with her master's degree in community psychology and counseling. She's worked in substance abuse program, a community mental health program, and a group private practice. After experiencing her own fertility struggles, she made the decision to help other women and couples navigate their fertility struggles and made maternal mental health the focus of her career. In 2021, Elena opened Bullock Mental Health Counseling, and she offers both in person and virtual appointments. Though she specializes in maternal mental health, Elena also helps individuals who are experiencing depression, anxiety, life transitions, and relationship difficulties. And I'm just going to add every one of those issues can stem from infertility. So, why don't you help me welcome Elena? Thanks for joining today.
Thank you so much for having me. I appreciate it.
Many people don't see infertility as something that could cause grief,
Mhm.
especially if the infertility, and I won't say is solved, but if it's resolved with a child, however that happens.
Correct.
And
Yep.
then, like, just be grateful.
Right. You at the end of the day, you got what you came here for, and we should be moving on. But yes, the process, if any of your listeners have gone through it, it is grueling. I know we had talked about before I had hopped on here that it is like having a full-time job. You're taking so much time off from work. You're taking time away from friends and family. It's grueling on not just yourself, but also your relationship, the people around you.
And there are constant reminders
Mhm.
of the fact that you're not pregnant yet.
Yes, and the medications that you're on do not help with that because it mimics a pregnancy. So you have all of these hopes and dreams that this is the month because I feel it. Finally, I'm feeling this. And then you get the blood test result and it's negative again. I remember when I was going through my own process and one of the she was a lovely nurse practitioner that I ended up having a very close relationship with. And I remember her saying to me, Elena, the stars and the moon and the planets and the sun, they all have to align at the exact same moment. And that's when it's going to happen. And I remember being like, how is all of this happening for everyone else? How is everything aligning for everyone else? But it's not happening for me.
It's a good question.
Mhm.
And my guess is that you never got that answered.
No, we never did. So I was actually diagnosed with unexplained infertility, which is one of the highest diagnosed conditions in fertility treatments. And what that means is just you're doing everything right, everything looks great, but you can't get pregnant.
It's basically we have no idea why,
Correct.
but we have to give a diagnosis because we need to get paid by the insurance company.
Correct. Yeah. So even to this day, I started my fertility junior journey in 2012. Still to this day, I don't know why I could not get pregnant. That's a whole nother layer of grief. It's like I'm going to the doctor, give me a diagnosis, give me a treatment plan, and let's fix this. And I never got one.
So tell us a little bit about your journey.
So my husband and I, we got married in our mid 30s. So when we got engaged, I was just actually finishing grad school. So we decided back in 2012 when we got engaged that we were gonna, come off of all of the safety precautions that we were using, and we were gonna jump right in because everyone's like, oh, it's gonna take at least a year to get pregnant. So we were like, perfect. In a year, we'll be married, and we've already jump started this.
Plus, just for our listeners, usually the medical profession requires a year of being unsuccessful getting pregnant before a diagnosis.
Correct, depending on your age, yes. And I was not quite 35 at that point. So, yes, they wanted me to wait anywhere between 1 and 2 years. If I was 35 or over, it would have been 6 months. If I was 40 and over, it would have been 3 months.
And
So,
for people to understand, 35 is a geriatric pregnancy.
correct,
Which
yes.
just, I can't imagine somebody at 35 being told they were geriatric
Yeah,
anything.
yeah. I remember when I was giving birth and they were like, "Oh, this one is an infertility patient in AMA." And I said, "AMA?" I go, I what's AMA?" And the nurse said, "Oh, advanced maternal age." I was like, "Okay." So yeah, so going back to our journey, so 2012, we were trying, we got married, test after test after test, nothing. So at that point, after we had gotten married, I was referred to a fertility clinic in the area where I had a slew of tests done. I mean, I think they took 20 vials of blood from me. And I did have to have a few surgical procedures done also. And then after that, it was kind of to the races. I started cycles. Some of my frustration with that was they still don't really know why this happened, but it took me a long time, even on fertility meds, to conceive because every other month they were canceling my cycles. So I would still go through all of the meds and all of the procedures and everything. And right before I triggered, something would not look right. And they would be like, we're scrapping this month.
Ugh.
So every other month, we were also devastated by that.
And the expense, because you've gone through all of the expense each month, whether insurance covered it
Yeah.
or not,
Yes.
and it was for nothing,
Right.
basically.
And so, I say back then, we're talking, I mean, my son, he just turned 9, but, so this was 10 years ago when I was, 10 plus years ago when I was trying to conceive. There was, for us, there was no insurance coverage. Now, today, insurance companies, a lot of insurance companies are covering at least some. Some of the people that I work with, they do have coverage. So at least we've been moving in the right direction with some of that. But yeah, we had to pay out of pocket for everything.
And it's expensive.
Yes, financially, the stress, right? That also really puts a damper on the relationship, also. So, like you're on all these hormones, take like again, you're taking time off from work, your bank account is being depleted, you're taking all of your vacation time because you have all of these appointments. Your intimacy is affected because everything is. I remember going home with a calendar and they were like, this is when you have intercourse. Do not have intercourse any other time except for these days. And we were like, it's so much. And then you have,
It becomes a chore.
it definitely does. And even hanging out with your friends who, now with social media and stuff, it's everyone was getting pregnant. Here's another pregnancy announcement. You go out with your friends. Why aren't you pregnant yet? When are you thinking of having children? And it's like, okay, like I'm on all these hormones. My clothes don't fit. I feel like garbage. And this is the last thing I want to talk about.
And it's very interesting that we have a lot of barriers around us to talk about certain things. Like
Mhm.
nobody, I shouldn't say nobody, but it's rare that somebody would say, how often do you have sex?
Right.
But they have no qualms about asking the most personal questions about infertility or about anybody's struggles.
Right. Correct.
There are no boundaries.
So like even some of my clients, I mean, this topic comes up all the time. Why are people so intrusive with their questions? Like, why are they asking me this? I have so many struggles with this. I can't talk about this. And so I always say to them, I'm like, listen, just tell people, I'm not in your uterus, stay out of my uterus. And I've even said to my clients, it's like saying to someone, well, when are you getting divorced? Right? Like, it sounds ridiculous. Like, no one says that. No one can predict that. So let's not ask these questions.
Let's have some more consideration to what the other person's going through.
Right. And, I'm always a believer in let the person in front of you do the talking, and then you go off from that. If they come up to you and say, hey, I'm really struggling with something, can I please talk to you? That is then your opening to be there as a support.
Okay, so let's go back to your story.
I'd have to go back and look at a calendar, but I consistently did fertility treatments. I did the different layers of them. So I did them for about a year. And like I said, the first 3 months were consistent. And then for whatever reason, something was happening with a new med regimen. And then I would be able to complete one cycle and then cancel, and then complete one cycle and then cancel. And we did that for 6 months additionally. And then finally, I remember that same nurse practitioner came in and I thought she was gonna cancel me because everything was, like, not looking great. She's like, "You only produced 1 follicle." your husband's sample was okay, but like just okay. And I remember being like, this is it. Like, I'm not doing this after this. This is my last cycle. If this doesn't work, sometimes when you just know, like, I just cannot do this anymore. So one follicle, like an okay specimen, and 9 months later, I had my son.
You only need one to work. So
Yeah, I had all these other cycles where it was like, you have 8, you've got 6, you've got 3, and nothing ever worked, and then I had 1, and that's all I needed at that time.
how was it for you going through the pregnancy? Were you very nervous and
Yes.
worried about a miscarriage or
Yeah, so I was very nervous. So after well, at least for me, after you conceive, with fertility treatments, you actually have to stay on them after like during the pregnancy. And no one told me that some of these meds can cause bleeding. So there were times when I woke up and I'm like, oh my gosh, I'm bleeding, like I'm miscarrying this. And it's just the panic and the overwhelm and the grief around that. So then I was also going back and forth to my doctor just to get emergency ultrasounds to make sure that everything was okay. But to be honest with you, I was pretty detached from my pregnancy. I disassociated a lot. I did not think it was real. A lot of times the women that I see will say, like, I'm not going to feel any type of joy or comfort or happiness until I'm holding the baby in my arms. And that is true. So that's how it was for me. Unfortunately, I remember some parts of my pregnancy, not a lot of it. I remember counting kicks all the time. And, I remember all the physical stuff because I was so hyper vigilant around that. And then I had the baby, and then postpartum was a whole nother thing, on top of that.
how did you feel with the postpartum?
Yeah, so postpartum was rough. I did have a traumatic birth. I actually lost consciousness and almost had a heart attack.
Oh
So
my
they had to
gosh.
revive me. Yeah, so that was traumatic. The rest of the birth actually was pretty much fine, but that part was very scary. And for me, the postpartum depression and anxiety happened immediately. And then I also had some complications after the pregnancy, which led to an emergency surgery a couple months after giving birth. So I had a few factors going on, and I also see this with a lot of my clients too. It's not just fertility treatments, birth, and we're good. A lot of times it's fertility treatments, pregnancy is great, birth is traumatic, and now we have postpartum related issues. I rarely see anyone, where everything is perfect.
We were very fortunate. We had a very short pregnancy.
Yeah.
We asked some family members and we got one of them had a connection in Mexico and said, okay. And a month after we asked, we got a call. There was a little girl born. Did we want her?
Mhm.
And it was, of course. But
Yeah.
there was a lot of fear about, I wanted to get down there as soon as I could. I was afraid something would happen. And I remember once we got Nina, they said, do you want her to stay with the foster woman? I'm like, no, she can stay with me.
Yeah.
I am not leaving this country and I'm not leaving this baby
Yep.
until we're back in the States and back home. So I don't think it ever goes smoothly. And that probably is true for somebody who does get pregnant without fertility treatments and everything's going to be normal. And there's really no such thing. With grief, we all experience things differently.
Absolutely. Hearing your story too, it almost doesn't feel real, right? So it's like you just want to hold that baby all the time, and I still get that even now, again, my son is 9 years old and I'm like, I still get these emotions and these like feelings of, I don't want you out of my sight. Like, you have to stay with me. I'm going to keep you safe. I'm going to keep you here.
I think that's being a mother.
Yeah. Yeah.
I'm not sure that it matters how you become a mother. My kids are 40 and 36. And, it's still, I just want to hold them. And, both
Yeah.
of them are mothers themselves. They're still my babies.
Right. And I think too, because you've wanted it. Yes, yes, it's because we're mothers, but our journey was hard. It was long. We prayed for these children for I know for me it was 4.5 years. I prayed and hoped and dreamed, and now I just don't want to ever let him out of my sight.
He will get to a stage that you'll be happy a little bit. I still tell my 36-year-old, she's my baby, and she's like, "I'm a mother. I'm a
Uh-huh.
I'm like, "I don't care. You're my baby."
That's
Just
right.
like my older one is my big girl. But I do remember having this thought, and it was because I worked in child protective services for a while,
Yeah.
especially when I was in grad school. I remember thinking, when these kids say, "You're not my real mom," or "You didn't want me anyway," I
Uh-huh.
have a long story to tell them about how wrong they are.
Yes. Yes.
So, how much of a practice, or how much of the practice that you're doing now, is with women who are going through fertility?
Probably between 90 and 95%. I have a really good, social network up here, professional network up here, where I get a lot of referrals. Like I'm known up here as this is my specialty, this is my niche, this is what I do. All the hospitals around here have me as a resource. So yeah, it's 90 to 95% is maternal mental health. I primarily, honestly, do telehealth. I find with my population that it's so much easier for them. They have their babies right there, especially if they're breastfeeding. They can just pick the baby up, breastfeed while they're doing their therapy session, put the baby back down if they're napping, and then same like if the children aren't feeling well, they can still have their therapy session and be with their children. So it's a nice service to have.
So, what else should our viewers and listeners know?
The other part of my chapter really goes into, ways that individuals can support their loved ones who are going through infertility. I think that is very important for everyone to know. I think at this point, maybe we don't exactly know for sure that someone is struggling with fertility, but I think we can gauge, like, oh, I know that she wanted to have children, but she doesn't have them yet. Like I'm going to remember this podcast, and this is the ways that, Elena discussed how to support, those around us. And
Can you
I
give us like three don'ts and three do's?
yes. So, and this is going to be for the people that are the support system and also for the people who are going through the treatments. The one thing with the people going through the treatments, to me, the biggest thing is setting boundaries and having your partner know what those boundaries are so you have that support system.
Mhm.
So it's not just you saying, no, I don't want to go to Aunt Mary's birthday party because I don't want to hear when are we having a baby. It's, the partner also saying, you know what, I'll take that off of your plate. I will respond to Aunt Mary that we can't attend at this point. So having those boundaries. The other thing is, for the support people is like I said before, have that person who is struggling come to you and open up the dialogue about here's what I've been going through. And really their job is to just listen. And that's it. And hold space for them. One of the worst things, that people can do is say things like, your time will come. Or just go to the spa and then go home and have sex, and your anxiety has to decrease and then you'll get pregnant. It's those statements that honestly are infuriating to
And
those that are struggling.
that holds true also for people with secondary infertility,
Yes.
meaning they did have a child biologically,
Yep.
and now they're having trouble the second time. And I can't tell you how many people said to me after we had our first child, and it was, she was 2.5, 3, and
Yep.
they're like, "Oh, once you adopt, you're gonna get pregnant 1, 2, 3."
Oh, yep. Or just be grateful that you have one.
I also heard people that can do, those who can't teach.
Yes,
And I'm
yeah,
like, "What am I teaching people how to get pregnant?"
right.
Or, like, it made no sense, and I was like, "Just stay out of my business."
Yeah, stay out of my uterus, right? So one of the other things I also put in the book is keep your support network very small. So I think I put in the book, have 2 to 5 people that you can just go to and say anything that you want to about what you're going through, what you're feeling, what you're processing, that you feel safe with and you feel 100% supported by. So, but that network should be very, very small.
And you talked about the support person being someone who just listens, and there's an image that the grief recovery method people subscribe to, which
Mhm.
is, if you're the support person, be a heart with ears,
Yes.
nothing else.
That's right.
You have no mouth
Right.
other
Right.
than to say, "Could you repeat that, please? I didn't hear it."
Yes, yes,
But
right. What you don't want is, "Oh, let me tell you about how I got pregnant," And a lot of times people will be like, "Well, I was just trying to relate to you." And it's like, "Well, no, now you're diminishing what I'm saying, and now we're focusing on you." That's the type of, non-support that you want to avoid.
and
Mhm.
it probably is coming from a place of love and caring.
Absolutely,
However
yes.
however, it doesn't end up being that. It
Right,
ends up with resentment and
right.
anger and, feeling inadequate.
Yeah, yeah. And I know a lot of my clients and even myself included, when I say keep that support system small, you also want to make sure it's small because when you go in and say, "Hey, I went to the doctors today and this is what they said my AMH is." You don't want to then be like have your friend be like, "Well, what is AMH?" Now you're like trying to explain the whole fertility process too. And that also takes away from, okay, well, is this now supportive for me? Is this being beneficial? Or am I just regurgitating everything that I just heard from my fertility clinic? So having those boundaries too. I just want to go, I want to be able to process with someone, have someone listen and validate me where I don't have to explain what all of this medical stuff is.
And one of the things to think about is, you may have wonderful family members, you may have wonderful friends. Sometimes the best support system is a professional who is not personally
Yes.
involved in your life, and they understand the medical terms or whatever else it is that you're going to bring up.
That's one of the biggest things that I hear in my practice is it's so nice to just come here and I can rattle off all this blood test results to you and I can tell you what all of these surgeries are that I'm having and procedures and all I just have to tell you like I'm doing X, Y, and Z and you're like, "Oh, yep, I know exactly what that is." Have if you could have someone in your area that is a maternal mental health therapist, that's definitely one of the most supportive options for this population.
Definitely. And the
Mhm.
other part of it is, if you have questions about, is this the right test for me? Do I
Mhm.
want to go through the surgery? How much time? How long do I want to keep doing this? When is it
Right.
over? To put a family or a friend in that position is tough on both sides.
Yes.
So
Yeah.
to talk to somebody who is a professional, who is knowledgeable.
One of the questions I'll get is, "When will I know when I'm done?" And I always say, "You're gonna know." And part of that is I can be there to help process that for them. And I've been there for a lot of my clients to just help process and identify their feelings and work through their grief of whether it's we're going to continue another cycle or we're going to call it quits for even right now, in this for this cycle or forever, and I'm able to be there for them.
Thank you so much. This is the book that we've been talking about, and all three of us are in with stories about our own grief experiences.
Mhm.
Both Elena and George talk about infertility, and I talk about the loss of my best friend and how hard that was. And in some instances and parts of it, it was harder than losing my mother, my father, my stepfather, one of my stepsisters, and my husband.
Mm.
That losing my best friend was a very different relationship.
Mhm.
And the thread that goes through all of this is that we all grieve for different things and in different ways, and no two people and the same person doesn't grieve the same way twice.
Correct.
Everyone, every time, and every loss is different. So, Elena, thank you so much.
Thank you for having me.
And reach out, people. If you need some support, don't be afraid to reach out.
Mhm.
It's not a sign of weakness. Neither is infertility. Getting through it is a badge of courage in many
Yes.
ways. If you liked what you heard on this podcast and want to hear more, please follow us and tell your friends. You can also find me on Facebook at Amy Lindner Lesser, Grief to Growth Life Coaching, and on LinkedIn at Amy Lindner Lesser. Thanks again for listening.